Hello everyone. Today I want to talk about a procedure that we did last month. It's called a robotic assisted DIEP breast reconstruction, or ROBODIEP. I was a part of this team that published the first case of a robotic assisted DIEP flap reconstruction in a patient with breast reconstruction. We did this surgery in 2017. This got published in 2018 when I was a fellow at the Medical University of South Carolina in Charleston. And now in my practice, one of this patient who is a breast cancer patient, she had right-sided breast cancer and she chose to have a mastectomy, and she initially wanted to have a tissue expander based reconstruction. So this is a picture which shows right mastectomy followed with a tissue expander placement that's been fully expanded. And this patient was interested in undergoing abdominal based tissue reconstruction. So we got a CT scan of the abdomen to look at the blood vessels or perforators for the planning of the DIEP flap. And this slide here shows you the blood vessel anatomy, which was very much conducive for a robotic assisted or ROBODIEP. So based on this anatomy, I discussed with one of the robotic surgeons and we plan to do a robotic assisted DIEP on this patient. This is a picture on the day of the surgery. These dots mark the blood vessels based on the CT angiogram. The right side is the reconstructed breast, and this circular island of skin is going to be replaced with the skin from the abdomen. So this is on the table just before the start of the surgery. So this is two-part surgery. The one part is a dissection of the belly flap, which is done on outside. And once we reach to the muscle layer, then the robotic surgeon comes in, puts a robot. So this is the robot that's docked on the patient. That's the patient laying on the bed. These are the robotic arms that are docked. And then the robotic surgeon sits at the console and then he operates these robotic arms to dissect the blood vessel. So doing so basically decreases the length of the incision on the abdominal fascia, which decreases the pain, decreases the length of stay in the hospital, and also decreases the complications of having a bulge or a hernia on the abdomen. That's the biggest advantage of doing this ROBODIEP. And then once the dissection is done, that tissue is used to reconstruct the breast. You can see here the white patch is a monitoring device that monitors the blood circulation or blood supply of the skin flap, and this is at the end of the surgery. And this is a picture that is 1 week after surgery. You can see this skin right in the middle is the skin from the abdomen, and then that's the reconstructed breast. It's just 1 week out, so patient's recovering really well, and I'm very happy that we can offer this procedure. Very few centers in the country actually offer this procedure, and we are probably one of the first to do this in New Jersey. And if anybody's interested in finding out more about this procedure, I'd like to have a discussion. Thank you.